know that you're coming in, you ask him his name and birthday. This is Mr. Wade, my name is Sue, we're gonna be putting on your stockings today. And then we're gonna get you dressed and go to the dining room, is that all right? So he knows he's gonna get his stockings on, he knows he's gonna get dressed, okay? So we're gonna do that. Now, you can do one or two things, and I brought the bath blanket, so I'm gonna go ahead and I'm going to get my bath blanket, because it doesn't say to use a bath blanket in that book, but how would you unexpose him to get him dressed if you didn't pull that down? I'm just saying. So I'm gonna raise my rail, and I'm gonna raise the bed to my working body height.
In that TikTok, they also wasn't raising our beds. They was just bending over. I'm just getting with that TikTok, man.
But when they were rolling the patients, I saw them whenever we were learning positioning, and they were rolling them towards themselves and putting the pillow.
That's
and I
when
was like, I got very confused at that rate.
I was like, oh my goodness, who? And then they asked at the end, what did they do incorrect? And they was like, oh, nothing. Nothing. And I was just in there talking rails.
No, I was everything.
Did you miss that part of the conversation?
Probably.
We were talking about TikTok. I think you were talking with her about something.
What?
We were talking about the TikTok people that weren't like doing it right.
Oh no, I heard that earlier.
That's what we were.
Yeah, that's what we were
I thought
talking
y'all
about.
watched it.
Don't watch
No.
TikTok, those things are not right.
I like TikTok. They're ridiculous.
Alright,
Mm-hmm.
so now I've got him. I've
Probably
got
my
the-
most used
I've
app.
got the covers. Now, in your dressing part, it says put on gloves. With the hose, it doesn't say use gloves, but if you want to put your gloves on, you can put the hose on. It's perfectly fine. Alrighty. Since it's a bundled skill, I would probably wash my hands and put on my gloves. Okay. Alright.
I have a question.
Uh-huh.
What if a resident wants to sleep with socks on? Can they?
Yeah, a lot of residents.
Just not like the stockings that are like
Not
compression.
just like the stockings.
Yeah, we take.
But those slicker socks, yeah, they can put socks on. Alright. So you're gonna expose his leg.
Oh, you don't got the hard ones this time.
So these are gonna be difficult on mannequins.
Oh, we had these white ones that was
Oh, they're in there.
really good.
They're in
Those
there.
are hard to get on the
So you're gonna
mannequins.
turn
Oh,
the
boy.
hose all the way down, inside out, to like down to the ankle and to the heel. Alrighty. You're gonna open at the toes. You want this open. You want it to go over the foot, right like that. I finally got those white ones on them.
Really?
Yeah, it took me a minute, but I got them on there.
Yeah, we stood there for minutes trying to get those
And this
stockings on
is-
the legs.
This is supposed to help circulate their legs.
It's supposed to help venous return, yes, and swelling. And why do we leave the toes open in the hose area?
So they can put
So they don't lose their toes if they have to get ankle tape.
Well, we want to make sure that we check for circulation to make sure that it's not too tight. You know what I'm saying? And that they've got good circulation in their feet. Alrighty, you want to make sure that you have no wrinkles and no creases in these hose. Alrighty, when you put them on. Alright. I don't know. Someone put a catheter there and left it, so I don't have any wrinkles or creases. Okay. So now, I'm gonna cover him up on this side. I'm gonna raise my rail, and I'm gonna drop the rail on this side, and then I'm gonna uncover. I would uncover his leg, and I would put the sock on this side, okay? And you can verbalize that. I think it says that, right? On page 16. You don't have to put both hoses on, okay?
I think we did verbalize it the last
We
time.
can verbalize. Or if you wanna put the other hose on, you can. Just, if she lays out two hose, what do?
Put on
Put
two
on
bows.
Put on two hose.
So if they can't only have one for one leg.
Well, they can only have one, yes. If they have like lymphedema in one side of the leg, they may order just one compression hose to that one side. Yes,
It doesn't say
Uh-huh.
verbalize,
Uh-huh.
but in this skill, I'm not gonna verbalize stuff. I'm just gonna do it. So like,
Well, I sort of
unless
say,
it's like hand washing or like
right, but if she puts out 2 stockings and they mate, then you know to put 2 stockings on the feet, on one on the other one, right? Same process.
and
So,
if they lay out one, then it's just
Yeah.
like
Mhm.
hurry up.
alright, so now we're gonna undress him. He's chose a red shirt and a pair of pants to put on, okay? So we've got the bed raised, and we're gonna take our clothes off the hanger. Now these are gonna be too big on him, but I can't help it. So we're gonna take the gown and undo the gown. You're gonna set him up and undo the gown, untie, without exposing him. And that's why I put the bath blanket on, cause I just don't think you could not expose him without a bath blanket, okay? Cause now in the old way, we had to put a bath blanket on, okay? So we're gonna put the bath blanket on and we're gonna remove, and it is a known fact that the side you drop your rail on in skills, that's the weak side, alrighty? Alright, so if I were over on that side, it would be weak on that side, strong on this side, okay? And I'm gonna remove his gown. Put our dirty linen at the bottom of the bed. We're gonna dress him on the weak side, so I'm gonna put his shirt on. I'm gonna roll him over. And buttons, your buttons. Now, I'm gonna pull my bath blanket down to his waist.
Is that not sleep with underwear on or like a bra? Do you have to put their underwear or bra on first?
No.
No.
Honey, when you get old, you don't worry about that stuff. You hear me? You just don't worry about a bra or underwear. You just don't worry about it. They wear brief most of the time. These pants, oh my God. Look in there and see if you can find, yep, Maggie. Look in there and see if you can find some smaller pants, cause I don't believe I can get them on him. They look pretty big.
Were those donated?
I'm assuming so. By someone quite heavy. There's a pair of pajama pants in there, I think.
Or khakis.
Or khakis or something. Yeah, there you go. That'll work. Alright, we're just gonna make them match. How about that? Same difference. You're still gonna put the pants on the weak leg first, okay?
It looks like he's going to the beach.
That's fine.
Isn't the weak leg the one on your other side?
No, that's the strong
The strong
side.
leg.
Oh, okay.
Weak is on the side that I dropped my rail on.
Okay.
Will we have to ask which side's their weak side, or will they tell us?
No, if you drop, it's a known fact, like I said, if you drop your rail,
The side you're working on
no,
is.
what side you're working on, that's your weak side. It is known that the other side is the strong side, okay?
I'm asking if like they will tell us which side.
No, you're just working on it. Like if you're right-handed, you'll just drop the rail on your right side and that'll be your weak side, okay? They probably won't tell. Now, they might, I don't know, but they, normally
Usually
that's
you
just
could
how it's been
tell.
done. Huh?
Usually you could tell if they're weak on one side.
Well, she's talking about during the test. I've never known them to say anything which was the weak side or the strong side. It's just whatever side that you're working from. Like if you're left-handed and you drop the rail on the left-hand side, then I know that's your weak side, okay?
Whenever you go work in the nursing home and stuff, you're gonna ask your patient, unless you can.
It's
or
on your
usually
care
it's
plan.
in-
It's
yeah.
usually on your care plan. Okay, Mr. Smith, let's roll over. So I can pull up these pants. Okay.
Are we gonna transfer by wheelchair?
Well, see, that's just what I'm saying. You might, because they're doing a bundle, you may get dressing and stockings and transfer to a wheelchair. Do you see what I'm saying?
Yeah,
As your bundle.
because that's 5 steps right there.
That's fine, well, hand washing,
And vitals.
vitals would be your last thing to do, so, yes.
Yeah, and then put them back onto the bed, and then.
No, they'd just be left in a wheelchair.
Oh.
You would be stockings, dressing, and wheelchair, and then hand washing and vital signs. That would be your 5 skills. Then you wanna make sure you put his shoes on. And if you're gonna put shoes on his feet, you're gonna put a towel on the bed and then put your shoes on. But since he's gonna wear these little slicker socks, I'm just gonna put his little slicker socks on. Alrighty? Alright. Well, I'm gonna remove my gloves. And I'm gonna leave him uncovered. I'm gonna make sure that he's comfortable. We've gotten him up in a wheelchair. He's ready to go to the dining room, okay? But to get him up, what would I have to do? What about that skill? Let's talk about it.
Get the wheelchair and lock it.
Well, you're gonna have to get the
Put it
wheelchair,
at
but where does the
45.
bed need to be? Does it need to
It
be
needs
up?
to be lowered and locked.
There you go. You're gonna roll the bed down.
Unless he's really tall. And then it would have to stay up.
Huh?
If they're really tall, it would have to stay up some.
What position does he need to be in?
Fowler.
Fowler's position. Then I would get my wheelchair, get him up in the wheelchair, and then get him ready and go to the dining room. Wash my hands, report, record, okay? But you may get that as a bundle,
Yeah.
alrighty? You may get it as a bundle. So, and it's not uncommon that you wouldn't get it as a bundle.
They probably will, because that's like, unless they're just trying to totally scramble our brains, then that's just like all that we,
Well, it's real life.
yeah.
I mean, and that's why they do pericare and a brief, or bedpan and pericare, because it's real life, already. So, you know, I don't know, but that's a good bundle right there, and you may get it.
That's a pretty easy bundle.
It could be, yeah. Now, one of the bundles they were doing was like, it was, they were in isolation, so you had to put on your PPEs, and then you had to change their brief and put them in their clothes. So they had to have a change of clothes, so that was a bundle. So you put your PPEs on, washed your hands, put your PPEs on, went in the room, changed his brief, put him in his clothes, then took off your PPEs the right way. You donned and doffed the right way.
And then did you take, you also did hand washing, but did you do vitals as well, do you know?
You do vitals, yeah, you'll do vitals in the opposite room, that's the last thing you do.
Oh, okay.
it'll be on that arm in that other room in yonder.
I can't do that.
We can choose to do the arm or somebody, can't we?
You can, but the arm's gonna be set up, so they prefer you to try the arm first, yes,
How many attempts do they give us?
3.
Okay.
They have the right to give you 3. Actually, it states just 1, but they will give you 3 times. They will give you 3 times. Okay? Ready? So. Alright. Okay, it is 6 o'clock.